Tishat, and a very good afternoon to all of you. Let me just share my screen. So, yeah, is the screen visible?
Yes, Dr.
Yes,
Veronica.
So today's session on grief and bereavement deals with a very important aspect of our end-of-life care. And we are in a special situation when we are talking about children, teenagers, but also infants, newborns. So the objectives of today's session are, first of all, to define the terms related to grief and bereavement. What are the myths and the truths about grief and bereavement in children and in parents of children? Understanding how children and adults perceive death in a different way. Identifying normal grief as well as complicated grief in families, in parents and siblings. And then how do we assess and especially manage grief in children? So we will see how strategies have to be adapted to the age, the development of the child. And understanding adult grief, when which is in relation with to the loss of a child, and which are the strategies that we can use in order to address grief in families. So there is a difference between bereavement, grief, and mourning. So bereavement is the state of having lost a loved one through death. And grief is the subjective feeling that people who are bereaved feel in response to that loss. That can be actually death, but that can be any other significant loss, whether it is loss of a healthy life or through a serious illness. We can also encounter grief or even anticipated grief with the prospect of losing a child in the future. Mourning is more of a social response to bereavement. It's an outward sign of grief for someone who has died, or it can also be the period of time during which these signs of grief are shown. So we show grief in the way we behave, maybe in the way we dress, and that is what we call mourning. I have these problems when this unmute. I'm sorry, we're not able to go to the next slide. I'm used to that. I escape. And yeah. So the myths about children's grief, many of us, or many of our adult colleagues maybe, believe that young children are not able to grieve. And if they do grieve, then they can resolve grief quickly. Because children, especially young children, are thought to be too young to understand what's going on when they lose a loved one. So we are more now talking about siblings of children who have died, or children who lose a parent or a close one. And it's important in today's session, we consider not only sick children who die, but also those children who encounter a loss in their family, among their peers, or relatives, someone they love. Or another myth is that it is better for adults to avoid topics that would cause children to cry. It is better not to mention the person whom they have lost. And there is also a misconception that if a child is actively playing, then he or she is not grieving. Another idea is that children do not grieve as much as adults, and they wouldn't grieve for so long, and they can get out of it in a better and easier way. And then many times we meet people who think that it is better for children not to see the person who has died not to attend the funeral because that is something that they cannot handle. So we'll see how this is very much age appropriate. Um, it depends very much from case to case, but these myths actually are things we can really face now and see how in reality children who appear to be playing and active, they jump in and out of grief very easily. So maybe in one moment they feel sad because they remember the person whom they have lost. And then 1 minute later they go back to their play. They are engrossed, totally engrossed in play. And that is very common in the way children grieve. And those children who are not allowed to grieve normally, not allowed to express their emotions, to cry, are actually at a higher risk of developing complicated grief and problems later in life. So if a child is allowed to see the person who has died, to see their sibling, maybe some moments before the child dies or a day before, it is actually very therapeutic and it helps them a lot in their grieving process. And children grieve differently at different ages, but there are definitely there are common patterns in relation with the way children at different ages grieve and understand death. So typically, children show this reaction to bereavement, and grief is a normal psychological reaction to such a loss, whether it's the death of a sibling or a parent, any other relative, or a friend. Now, classmates of children who have died may need also grieve bereavement support. Or they also grieve in anticipation of their own death. And very commonly, we have children who are sensing when they enter the ICU, they say, this time I won't get out of the ICU alive. And they anticipate their own death. And there are emotional elements, physical, cognitive, and behavioral elements, which are manifestations of that grief in children. And it's not just one, it's not a static way of showing grief manifestations, but it's very dynamic and children can, as we said, move in and out of grief, but also go from one type of behavior to a physical symptom to some emotional manifestation of grief. And in order to understand the concept of death, we need to explore the child's past experiences and to understand the stage of development they are at so that we can conceptualize how much they are able to understand about the death that they have faced. So when talking about different ages and the typical understanding of death that children have, usually infants and children below the age of 2 years cannot really understand death, but they sense very deeply separation from the person who has died, and they sense the emotion that others around them, around the person who died, are expressing. So they are very sensitive to that, and they often manifest it by withdrawing, being more quiet, decreasing their activity, maybe having poor appetite, poor sleep, weight loss, or by being irritable. So they sense that something has happened. They sense the absence of the person whom they love and from whom they were dependent, especially if it is their mother, for instance. Older like toddlers until the age of 6, understand that being dead means not being alive. But this is usually understood as something temporary. It is reversible. Now, maybe the cat is sleeping and will come back to that, to life. No, my cat is dead, yes, but and they have usually their response to that is like what they're very interested in. What do the dead do? how do they eat, who brings them food, and their magical thinking is very typical of that age, which is to think that something that they may have done or said or thought has caused the death of that person. And they often feel that it is their fault that the person died. So if my words, maybe I got angry with this person, if my words have been able to cause the death, they can also bring back the person. But after the age of 6 years, that magical thinking is no longer there. And children at that age, 6 to 10 years, usually, I mean, it's a very, it's not a fixed age to think about, but it's like a continuous process. They have a morbid interest in death. They start getting more interested into the manner of death. What happened? What did they feel? Um, and they understand the finality of death. That death is the end. A person will not come back from if that person has died. And they also understand that if this happens to others, it may also happen to me. I may also die. So, and they also have they have an understanding that this person maybe lives in a different way as a spirit, and they are more amenable to the idea of a relationship that can continue in a different way with a person. A reaction that can be seen in at that age group, the exaggerated reactions are often seen to the idea of death and dead things. So they can have fear or aggressive behavior, or they can be concerned about some imaginary illness, that, oh, maybe I have this illness and I may also die, or no, they can be very much over focused about all those ideas. So it's very important to assess what all the thoughts and emotions that the child may have in relation with death. Adolescents have a concept of death that is much nearer to adult concepts. So it is final, it is universal, yes, everyone dies. It is final, but it is not for me. Teenagers usually feel that they are immune to death. So they can drive the motorbike at a high speed. Accidents don't happen. Death won't happen to me. And death is something seen as an adversary, something we have to fight, to combat. And the idea of possible death, even if I'm talking about my coming death, or related to the death, to grieving the death of someone else, a loved one, may lead to changes in eating habits, sleeping disorders, as well as regressive or impulsive behavior. Risk-taking behavior is quite common in adolescents, but maybe even more as a manifestation of grief. And all these are normal responses we are talking about. Feeling guilty of being alive. Why did this person that I love die and I'm still here? And also they have that, they can develop that protective attitude of protecting others around them. If they have lost a parent, protecting the other parent, protecting the other siblings, which is also an added responsibility that they may take upon themselves. Sorry, we are just having a technical issue. I'll stop sharing and share again. Every time we go this admin things. And as adults, we know that for us, we understand that death is permanent, that irreversibility of death. Non-functionality, which is that all functions cease at the time of death, functions that are related to a life organism. The universality of death, which is that all living die, including ourselves, and the causality, that there are reasons for which someone has died, physical reasons. It is not that magical thinking of I thought or I said something. So to be more practical, we'll take an example of a grandfather who has died, and watch each child in the family will understand about death. A 3-year-old, an 8-year-old, and a 14-year-old. So I give you a few seconds to think, and then we will see what can we do to help each child. So the 3-year-old may say that I am sad because grandpa has died. Then I played when he told me to have food. I did not listen to him. So he left. He left us. He left me. So now who will bring him food? When will he come back? No? And there it is important to help the child understand that the fact that grandpa has died is not a punishment for your not obeying and not going to have your food. So it's not your fault. Now his body has stopped working, so he won't need food. He won't need anybody to bring him food. He will be happy without food. Then his body does not breathe, does not see or smell or eat or move. But his spirit will live on, and our memory of him will live on in a different way. So that will depend on the family's belief system. So he will not come back, and that is something that will not be understood by the child immediately. And again, the child will keep on asking. So we need to help the parents to give them the tools to be able to handle the questions of that 3-year-old child and not to get upset and impatient with the child. Whereas the 8-year-old will ask a lot of questions about death-related details, such as who is death? They tend to see death as a person. Is it a skeleton? Is it an ugly person? Which kind of spirit is it? So, or they will also say, how did that person, that death, which they personify, come to take him? And what happens to his body now? No, they can have very, how do you say, very funny kind of questions now. What happens to his body? And can I see it? Can I see his body now? Can I touch the body? And it may be useful at that time. I think quite useful not to separate the child from seeing the body of the grandfather. Understand the heart is not beating, because they will have these very specific questions. The skin has become cold. And we can offer additional information about what led to death. The heart stopped working, or there was a cancer. What is the cause of the death of grandpa, or just old age? And questions will keep on happening, and that's fine. We're always open to answer those questions. The 14-year-old will have more questions, not about how did it happen, but questions about the meaning of that and the future. What will happen now? Because what is the impact that the death of grandpa will have on others? Because that teenager is able to recognize that. How will grandma manage without him? What will happen to his business? And mommy looks so sad because she lost her father. So I can't say that I am sad because I need to support her. I don't want to add to her sadness. So if the teenager is given an outlet where he can express his or her grief without increasing the grief of his parents, then that can be also very therapeutic. So Elizabeth Kubler-Ross has extensively worked on what she described as the 5 stages of grief. And these stages are not actually something chronological. One can go in and out of grief different stages of grief, and but typically this is described as denial, saying this isn't happening, it can't be true, and then anger. It's not fair. Why is this happening to us, to our family? And then the bargaining is like, okay, don't take her, take me instead. Or if I could just, the child maybe would think, if I behave better, then my grandfather won't die, or wouldn't have died if I had behaved better. Things would be different. Um, and then there may be a state of depression, saying that what is the point if in anything, because that is really terrible, whatever has happened to us, to our family. And until the person reaches a point of acceptance, many months may pass altogether. The acceptance of saying, I miss my mom, I miss my brother, my son, but things will be okay. Life goes on. And more recently, in the institute that Elizabeth Kubler-Ross founded in the UK, there is a sixth stage that is coming up as very, very powerful, which is finding meaning. What is not just the meaning of the life of the loved one that we have lost, but which meaning has my life got now? Maybe I can find a way of, I don't know, replacing the person who is missing by doing some social kind of activity. Or there are so many ways of finding a meaning in the life of the person whom we loved, and that is even more powerful than just acceptance. It's giving meaning to the loss. So, for parents who lose a child, it is one of the most difficult griefs that we are encountering. It is not normal, not fair that a child dies before his parents or her parents. And that typical grief, and we would say normal grief, can last up to a year. And it is not unusual. So in the first days, we usually encounter that phase of denial, disbelief, numbness. Nothing enters into their mind, their head. We may give all types of medical explanations to the death of that baby, but it doesn't. They don't comprehend anything. In the following weeks to months, they may go into that psychological sadness, frequent bouts of weeping, waves of grief, and that come just suddenly, and they need to isolate themselves from the rest of people, maybe during I don't know, a family gathering, and then they may have also somatic symptoms when anxiety, poor sleep, and disorganization in their daily routine, especially parents who have looked after children who had special needs for a long duration of time. Their whole routine has changed. They used to give tube feeding every 3 hours, and they were constantly looking after the child, and suddenly it's like there's a void. What do I do with my life, with my day at home? And then they may have preoccupation also with the memories of the child. Have we done everything we could? Have we been good parents? Feelings of guilt or blaming others for the death of our child, for the things we would have wanted to do, for the wishes that our child expressed of going to the village, and we did not grant that last wish because we wanted to do everything to save the life of the child. And social withdrawal is a very common reaction, not wanting to meet people. What do we talk about? And after some time comes the time of reorganization of their daily life, recovery, with resolutions of those psychosomatic symptoms, of those psychological symptoms, and they restart social activities. And they are able to bring more to their mind the memories of the good times spent with the child. So accompanying them in that journey is very important. And maybe helping them, or part of our work is to help them to create good memories while the child is still with them, so that will help them a lot in that grieving process. But grief can be complicated when it is inhibited or absent. They are not able to express their grief. When grief is delayed or prolonged. So it's a little bit difficult to say a timeline, but usually beyond 1 year is considered prolonged grief. And grief can be distorted. Anger or violence can be such manifestations of grief.
I think that this term complicated grief, often parents who've been through grief say all grief is complicated. But what we are highlighting here are patterns of grief that may cause significant distress to the griever. Now, when Dr. Vero talked about inhibited and absent grief, this is when a griever avoids facing the realities of losing something or someone by turning their attention into an act or doing something that will take all their energy and time. So, they will hide their feelings in the hope that they don't feel the grief. But as we all know, inhibited and absent grief, or these emotions that you suppress, will eventually catch up, and it leads to symptoms such as it may manifest in form of migraines, digestive issues, nausea, and eventually will lead to exhaustion and burnout. Then Dr. Vero also talked about delayed grief. Now, what is delayed grief? Sometimes, and you may have seen that, in your lives with, in your lived experiences, that when a loss happens, the feelings of grief don't instantly or immediately appear. If you lost someone valuable or something valuable, it takes some time before these emotions of grief appear. And for some people, as time goes by, and those feelings become stronger and stronger, and delayed grief sometimes seems it happens when alongside the primary loss. So for example, if you've lost a loved one, alongside that, if you've had a job loss or if you've had financial crisis, now you're having to deal with two losses at the same time, and then you feel you can't allow yourself that space to grieve because you're sort of just coping. And these are times when you experience delayed grief, and people experiencing this will eventually need a lot of support, and psychological support and social support. Prolonged grief, again, when grief so intense and so raw, beyond a year, beyond, technically there's no sort of a guideline how long you can grieve. And I remember David Kessler saying grief um, grief really is the manifestation of how much you loved that person. So as long as that person remains dead, you will continue to grieve. But when we talk about prolonged grief, or we talked about complicated grief, it is when grief and these symptoms become so intense that they come in the way of you carrying out your day-to-day activities. When even after a year and a half, you're not able to sort of function normally, and that's when you identify somebody as experiencing complicated, prolonged grief. And lastly, again, distorted grief, where you sort of grief manifests in spurts of anger, violence, which is not characteristic of what the person's like prior to that loss. And so, again, and there's one actual grief pattern of grief which Vero talked about a little earlier about anticipatory grief, and there's also another one called disenfranchised grief. Now, what is disenfranchised grief? It is grief. Society has a value on what one ought to grieve about. So, for example, for those of you here in our class today who've had pets, and if your pet passes away, if your pet dies, maybe a little fish, it may be a cat or a dog, and society may not place any value on that loss, and therefore you start feeling that nobody's going to understand me. I just have to suppress my feelings. and just carry on being normal. Disenfranchised grief can also be relationships that society don't approve of, where there has been an emotional connect, where there has been investment, and that person or that that person has died, and the society won't allow you the option of grieving for that person because they don't accept that relationship. So these are really forms, patterns of grief, and there is no sort of a simplistic way. It's just for us, these labels really enable us to sort of, for those of us who've not had much experience with grief, to understand what our clients are going through.
Sorry about the. I can't move forward from time to time. Yeah. Okay. So we will go through a few cases, starting with the story of a teenager who lost his mother in a fire accident, during which he was also he had significant burns. A 17-year-old boy lived with his parents, and his mother Sally caught fire, and all three were burned, trying to extinguish the fire. So he was admitted in our pediatric hospital with 30% burns, and maternal relatives were the ones taking care of him. But his parents were admitted in an adult hospital, and his mother succumbed to her burns. The father was still in hospital, severely burned, 40% burned, but the boy was not told about his mother's passing. And we were called upon in order to help the family break that very, very difficult news of the mother's death.
So again, the scenario is such that this boy is in hospital. In his mind, he doesn't know where his parents are. The maternal family were the ones looking after this boy in hospital, and for all of them, there was shock, disbelief, and fear for the patient. There was a lot of fear amongst family members about this. What would happen to this boy when he finds out? Because he doesn't know that his mom has passed away, and they do not have the courage to break it to him. So they came to the palliative care team, expressing an inability to disclose the sad news because they're still dealing with their own loss, and having to break this news of this mother who's passed away was very, very significant to this boy. And our team, with the psychologist and the male nurse, because this was a big boy, uh, we gradually broke the news to this boy. And it took us some time because the family were constantly hiding the fact that his mother had died, and he had actually, in fact, seen. This is the day and age where people are putting statuses, and he had seen a picture of his mother with a lamb, and he couldn't understand what it was about, and he really appreciated the honesty. But having said that, after breaking news, um, there was shock, disbelief, there was a lot of anger. He started hitting himself, he started feeling very fearful and was filled with despair. And a predominant feeling, I remember this boy saying, it should have been me. I feel guilty being alive and not saving my mom. And soon after, once we'd broken the news, he went through real symptoms of post-traumatic stress disorder. He would sort of completely blank out, stare at the ceiling, just feel numb and just not eat, would wake up with nightmares. And so we picked up all of these symptoms whilst he was in hospital. Of course, we made a referral to a psychiatrist who gave him medications to manage the post-traumatic stress symptoms. Alongside that, we had psychosocial intervention. So we had individual counseling for the boy. We had family counseling. So initial sessions were without the boy. We just had the extended family talking about what they were experiencing. And the father who was in the other hospital, he had recovered, but he didn't feel ready to come and see the boy because there was so much shame, there was so much guilt. But once the counseling kicked in, the medication started taking effect and took the edge off the symptoms. We started doing some more, psychological work. We got him to draw eco maps. Now, eco maps are really, helpful in drawing out who are the significant people in your life. Where do you draw your support from? Who are these friends? Who are your people? And eco maps also help you reminisce over times with your loved ones. And he talked about things that were important to his mother, the celebration over his amazing results just a few weeks before mom passed away. And then again, as we know, Dr. Vero talked about grief being not linear, it's very messy. And just when he was starting to cope with okay, accepting that mom won't be back, he would start having thoughts about who am I going to live with, or where will I go? I do not want to live with my father. And so, whilst at one stage he's coping and you feel like he's moving forward, there would be a surge of grief and emotion that would take you two steps back. And that's what grief is like. And, we've put feedback here, but this young man had moved to Hyderabad to live with his maternal family who've looked after him, taken him under their wings. He is now doing engineering, and he gave feedback that actually the honesty and the space that the palliative care team provided was really instrumental in him managing his feelings and making decisions about his future. Sorry, oh, and I've got this little image here that sort of tells you about the difficult equilibrium. Sometimes you're grieving the person you've lost, and whilst all of that pain makes you not want to move on, there might be things that help you sort of move on in life. For this young boy, it was his family, but sometimes whilst you're coping or whilst you're moving on, you also feel that guilt that perhaps I shouldn't move on. I should stay with this grief. I should stay with this pain. And that's the dilemma that really people experiencing grief and what prevents them from actually moving on.
And this is a younger teenager whom we had to prepare for death. So she was 13 years old, had thalassemia major, and used to come to the hospital for her 3 weekly transfusions since she was diagnosed at the age of 6 months of age. And then she developed a chronic myeloid leukemia with blast crisis. And so then there was increased frequency of hospital visits. So the father explained to her that she needed more blood, more new medications, but there was no plan for going into aggressive treatment, and that would also possibly need bone marrow transplantation. So the family had opted for comfort care, and she was symptomatically managed for her pains. We had to give her morphine that was relieving her bone pains very effectively. She had also symptoms of early satiety. She had lower limb edema. So as much as possible, symptoms were managed. But she was getting increasingly sick, and we knew that we were getting closer to the end of life. And that was on outpatient basis.
Right. Yeah. So this young girl continued to be at home, and she would come to see us when she's having transfusions or when she had her OPD appointments. So the initial sessions primarily focused on working with dad because he was the primary caregiver. He was the one bringing the daughter for her transfusions, for her appointments. And you could see that, he was protecting the mother as well because he felt mom wouldn't cope. So he had taken on all the stress on himself. And so he would diligently come, but just, had drooping shoulders and, frown lines on his forehead. And you could see that he was really struggling. And so, he had to miss work to come to bring this girl to her appointments. And you could tell that it was really weighing on him. So initial sessions really focusing on what he's experiencing, that he was experiencing, anger, experiencing disillusionment and burnout. And he was also feeling very isolated in his grief. And we really had to encourage him to, open up and talk to his wife and to share his grief with her. And what he was experiencing was anticipatory grief. His daughter was still alive, but he had this insight that she won't be alive much longer. And so initially, after getting him to talk about his emotions, validating them, we encouraged him to speak to his wife and other family members. We also eventually got, consent. We had a joint session with the parents, and they gave permission for us to talk to this young girl about her own death. That that things were not going as planned, and that she was going to die. And I have to say, there are very few parents who allow us this permission. And this was one of the first few young families that we worked with that allowed us that. And I still remember the session where we sat together and we discussed, her illness with her and what she knew of it. And we also talked about and what she thought was happening. And often young people know that the treatment's not going as planned, that something is going to happen. And we, articulated this and in that session, it was really reassuring. The parents, they all sobbed. They were all consoling each other. But they also reassured her that, we are with you and it will be okay. And we talked about what are the things that she wants to do with the time that she has left. And she talked about the family members that she wants to see. And one of the most lovely things, actually, one of the wishes she expressed was that she wants to go to Gateway of India with her parents, and that was a wish that she had because for a lot of our children or the young people we work with, a lot of their lives are focused on getting treatment, and there's no other, recreation. There's no other sort of downtime, and this was her wish to go and see Gateway of India. This young person passed away at home a week later, and the father still keeps coming back every year to talk to us. I think he found that the hospital or the space that we allowed them in our unit as something that brings him closer to her memory, and this really is a piece of work where we were able to talk to a child, a young person, about her upcoming death and about her wishes.
I think a very important aspect of this case is to also highlight the fact that conversation with a child and with her parents. Most of the time, I think those difficult conversations happen in the presence of the parents and always with the consent of the parents. A few times, though, we have had these conversations with the teenager alone, maybe older ones, who know that their parents need to be protected because when the parents are not wanting the child to know the truth and the teenager already knows and feels, then we have these type of conversations alone with the patient. But most often, I would say, in collaboration with the parents. And that's very comforting for the child also, not to be alone with us.
So, what are the ways in which we can help children in their grief? Like I said, with we validate their feelings. Feelings. What would a person be feeling? Feelings about loss, about sadness of not being around to be with their siblings, or worrying about what will happen to their children, what will happen to their parents when they're no longer around. We allow the child to choose with whom and how they get support. That there might be certain family members that they're closer to, and following a loss, they might choose to talk about their feelings to a certain family member. It might be a grandparent. It could be somebody they've identified. We provide creative outlets, journal writing, drawing feelings, writing letters. I've had siblings who've written letters to their sister who had died, and they're just so beautiful ways of expressing. In fact, in our, we also have a dollhouse in our unit where there is a family, a doll family, and children. We had a young girl with type 1 diabetes who had lost an older sibling to diabetes. And she talked about her loss through role playing with the dolls. And it was very cathartic because up until then, she wasn't really talking at all. And so, play is a very important way of reaching out to children and helping them express, as it is with art and journal writing. We encourage children to talk about happy memories with the person who's passed away, not just the sad ones, to really find meaning. These are things that help you find meaning in your loss. Another thing that really helps is a memory box, helping children, collate or bring together items that remind them of the loved one that's passed away, and keep them in this box. And you open the box when you miss them very bitterly, and it brings like catharsis. It brings a channel to really sort of remember your loved one, to express what you're feeling. Uh, One of the other things that we find very helpful are support groups. We run bereaved children's and parent support groups, peer support groups, and these are really very helpful. Um, so, what are the advice we have for parents of grieving children? Um, what we often tell families that we work with is that do not exclude your children from family ceremonies and funerals. Offer them an option to say goodbye to the deceased. Now, I know that you know every family has different sort of family rituals and ceremonies, family sort of culture as well. That men, for example, in some cultures, men are the only ones who are allowed to say go to the burial ground. And so, of course, one has to be mindful of these rituals. It is always family led. However, it's important to find ways to include children in some way. So, for example, if the child was not allowed to go to the burial site, perhaps the child could make a card which could be, either buried with the loved one. So they have the option of saying goodbye. As far as possible, keep communication direct and open. It helps the child express their feelings and avoid confused ideas about how death happened. A lot of people say, they, in our culture, we say the person's gone to sleep. Now, that's not necessarily helpful because a child's going to start hoping that the people who sleep also wake up. So it's often, I think, of value to name it as the person died. Encourage child to ask questions and seek help with answering. Sometimes the child may ask you questions which you're not comfortable answering, or if your grief is so much, you might want to buy some time, and say, "That's a very important question. Can you give me some time to find out how I can answer that?" As professionals, as people, encountering loss as well, you share it's often helpful to share your grief with your child, so your child is comfortable sharing his or her grief with you. Often, as adults, we feel we have to be brave and strong, and we can't really tell our child that we're sad. What ends up happening is when we project that, we don't allow permission for our children to grieve. And it's okay, as we all know, grief hurts and it's painful, and it's okay to tell your child that, yes, you miss the loved one who passed away. To reassure the child that the feelings of grief are normal and that everyone grieves differently. There is no set pattern. Mommy might grieve by maybe, crying in the evenings or talking about the times when the loved one was around. So each one has a different way of grieving, and there's no right and wrong, and that is perfectly normal to grieve.
So when we are looking at a child who dies, we have parents' grief and we have sibling griefs. So this is the case of a 7-year-old girl who had refractory acute lymphoblastic leukemia. She had received multiple chemotherapy and immunotherapy agents. Allogenic bone marrow transplant was planned. Her brother was a full match, but that was denied because she didn't achieve remission despite all this treatment. The parents kept on having high hopes of cure, saying that, okay, this one is going to work. But when all treatment options were exhausted, they finally accepted the fact. It took really a lot of conversations for them to accept it, and they went home finally for end of life care. But before that, I think Joanna is going to explain how she really managed working with this girl, with her brother, with her mother. And so she went home, which is in another city outside Mumbai, with all the guidance for symptom management at discharge. And emotional support was continuously given by WhatsApp messages and video calls. And she died a week later at home.
So when we are talking about this particular family, this was a family which was a devout a Catholic family, and they had a very strong faith that that Jesus would heal their daughter, and that even considering the possibility that the child might die would in some way be doubting your own faith or doubting what God hasn't planned for you has planned for you. So in a lot of ways, we as a counselor working with the family, often faith gives us resilience. But in this case, faith was preventing them from even considering the possibility of what if God's plan for this little girl uh, was what was going to happen. And so there was this dilemma of I can't doubt my faith. I can't even consider the possibility that my child is going to die because that would mean I doubt my Jesus. And so when we didn't have explicit permission from the parents to talk to this little girl about her death, but uh, the child had a good rapport with me, and um, she talked about a few days before she died. When I went to read her a story, she stopped me and she told me that she had a dream, and in her dream she was on a swing, and the person who was pushing the swing or swinging her was Jesus, and there was peace and serenity, and that she felt that it would all be okay. Now, uh, I think that it was a really beautiful conversation because mother was around and she was expressing that she already knew what was going to happen, and she asked me uh, to say a prayer, which is a prayer for protection that she uh, as her mother used to read to her, and we prayed together. But I could see that soon after that conversation, even her respiratory distress was less, and she was at peace with what she was experiencing. There are often barriers to preparing siblings. There might be denial. There might be, oh, we don't want to subject the sibling to this. Let's just sort of let it be. In this particular case, mother allowed me to work with the sibling, but there's often following the loss of a child, there is family disorganization. So sometimes the loss of a child can bring a couple together, but sometimes, as it was in this case, the parents separated. And of course, we provided them couple counseling, we provided them individual supports much after the child had passed away. We provided bereavement support through calls, texts, and letters. I earlier mentioned that the sibling of this girl, they were very very close, and he was grieving. He lived in Pune, and I was in Bombay, so we uh, wrote emails to each other, and eventually he wrote letters to his sibling and talked about how he misses her and how he wishes she was here. 8 months on, they came back to Bombay in December, and they went back to Marine Drive, which is a place that they had their last happy moments. And he, threw a coin in the water and released a balloon as a way of sort of, sort of cherishing her life. And I asked mom at that stage, what does grief feel like for you? And this was her quote: "Grief to me is end of life situation for me. As simple as I am alive because I'm not dying. Yes, I have a son to look after, but my grief doesn't seem to capture this person. But this is what grief has done to me." Now, this was, I think, about 8 months into her grief, where she was still really, it was very raw, and she was so focused on her grief for her daughter that she couldn't see, or although she could see, she wasn't able to dwell into what it meant for her older son, who was also a child, a couple of years older than the daughter. So this is an expression of what grief feels like for a parent, that you can technically see all of the stuff that's happening around you, but you sort of lose control and are not able to reach out to other members of the family. Now, what are indicators? No, some time back we talked about complicated grief or prolonged grief, or grief that comes in the way of people maintaining an adequate functioning beyond, say, a year or more. Now, considering that grief is nearly always complicated, certain individuals and situations with a higher risk or greater vulnerability to experiencing grief And these could be identified as complicated. Now, for example, someone who prior to the loss has had a history of mental health problems, a history of depression, or parents who are already marginalized in a society. For example, in our hospital, we had a young boy who had drug resistant TB, and his mother was a widow. Now, she was already socially isolated because of her widow status. And then she lost her son as well. So you can imagine how marginalized she was and how socially isolated she would be. And we knew that we had to offer this mother extra support. Then parents who are socially isolated for various reasons, either divorced or, there could be several factors. Then parents whose support networks become ineffective in the face of death. So it could be that your family members stop engaging with you, or there's blame. Often in our society, women are to be blamed for the child's death, that you didn't do enough, and then the husband side of the family will cut you off. Or so these are people who are at risk following a loss of experiencing complicated grief. Then there are those who may be discouraged from expressing their grief or not have an opportunity to do so. Those who perceive the death as sudden and untimely. I worked with a family, a couple, an elderly couple whose 21-year-old on Father's Day just died of a sudden heart attack, and they experience prolonged grief because of the suddenness of it. Then there are parents with concurrent stresses. So this could be financial or marital stress, and that puts them more at risk of complicated grief. Parents who are ambivalent about the relationship with the deceased. We assume that that the parent-child relationship has been cordial, but there are situations where we've had parents who are separated, where there's a very abusive parent who was very abusive to the mother and the child, and they've separated, and the child reminds you of that partner who's separated, but and that child has died. Now there are so many feelings, ambivalent feelings that it brings out in the parent who's bereaved. And research has shown that low level of education is often associated with adjustment difficulties among bereaved. I have to say that in my hospital, most of the people we work with have low education, and in my sort of practical and personal opinion, I don't necessarily see this as a causative or a link to complicated grief, because there are other factors that come into play, not just education. But this is one of the research articles that had pointed out to this, and this again might be a Western study. The identification or absence of grief and delayed grief reactions, like we mentioned earlier, where people who've experienced loss might not dwell with their feelings of grief or put it away and get engrossed doing something else, focus on their work or focus on things that will take their mind off. If you continue doing that for a long time, then you are at risk of depression and burnout. Studies have sort of looked into what parents report as being helpful in their bereavement. And parents and the studies have highlighted that having a sense of control and regaining control is important in building the assumptive world. So you want to have control about the information with regards to your child. You want to have control about what you would like to see happen with regards to your child, and that you've done. And parents want to hear that they've been good parents, that they've done all that they can. And this is something as pediatricians really, really important, because sometimes it's often there might be gaps in follow up, or they might not have been able to come back. But often at that stage when they're losing their child, parents want to know that they've done their best with whatever they had, resources they had possible. Parents would like to be asked opinions, um, and uh, and would like others to actually listen to them. They like to be given information, and sometimes, if you're a GP and you work with this family, you tend to get a little protective, overprotective, and you may not give information. And sometimes this disempowers parents. So, as far as possible, to be open and honest, linking objects to the child which assist parent in their adjustment, staying connected as they move forward, and so it might be that this is a family you worked with, the parents continue coming to you for a sibling that you're seeing as a pediatrician, and it's okay to sort of talk about the loved one that they have lost, to bring normalcy in their lives and to normalize that loss. And to attempt to make sense out of that and find meaning. Now, this is something that takes time, and families find ways of finding meaning. Like the young girl I talked about who died at home, her mother came back and she raised a significant amount of money for children with cancer, and she gave some money to Tata Memorial Hospital and to Wadia Hospital in memory of her daughter, and she is functioning really well now. Every December she makes it a point to do something in her memory. um, what helps parents is talking to other parents who've experienced the same thing. And it's common to all of us. When you know somebody who's been through a similar situation, you feel that they would empathize and understand. Helping others and contributing to society through working with children, the homeless, returning to school, or changing careers in order to benefit others. Now, these are some ways in which people feel giving back might help with the feeling of loss and finding meaning. Creating memorials or scholarship in their child's name. I mentioned about how this 21-year-old boy died and his elderly parents were in shock and prolonged and complicated grief. Uh, 2 years after their son's death, they went back to the school and paid money for a new playground in that school and named it their son's name, uh, son's memorial playground. And that space brought so much joy to so many children who are poor, and that brought meaning to their loss. Engaging in creative pursuits, writing, journal writing, sculpting, poetry, gardening, as well as are very therapeutic, and seeking therapy and seeking support from their spouse and children. Now, with regards to this 25-year-old, the one who I worked with them for over 2 years, and they had a ritual where they went to Kashi, and each of the family members, I encouraged them to write a letter to their loved one. And as they took a dip in that holy uh, river, they put they let their letters go, and it brought them a lot of relief and catharsis. And so these are some of the things that help. Now, what are some of the things as people, like, now this doesn't have to be you as pediatricians, but individuals who are living in a society where people are experiencing loss. Particularly here, we're talking about parents who are experiencing loss. What do we anticipate and how do we manage? Now, advising parents we ought to advise parents to expect difficult times and situations. As pediatricians, if you've had a patient who's died, you may want to tell the parent that yes, it's going to be a tough time. Some of these difficult things are when parents are asked a question. A bereaved parent is asked a question about how many children do you have? Now, this is a very triggering question because parents often wonder, do I mention the child who I have lost? And to recognize that these are difficult questions. These are questions that will evoke responses and triggers to bereaved parents. Special occasions, due to their children's absence from an inability to celebrate in weddings, birthdays, and holidays. Like I mentioned, the young man who passed away, who was 21, passed away on Father's Day, and every other Father's Day since then has been very, very traumatic for the family. And to anticipate that, insensitive comments and behaviors among family and friends about the child's death, that we come from a society where there is a lot of blame attributed to the primary caregiver. And often, sometimes, these are women who are really struggling with multiple children, who are doing as much as they can with limited resources. And insensitive comments and behaviors from family members can have an adverse effect on them. The first year and milestones that that life brings. So it could be the first Diwali, Christmas, Eid, birthday, Mother's Day without the child are particularly painful and dreaded by bereaved parents. I think, Dr. Ishak, do we still have time to have one more story?
Yeah,
Mhm.
yeah, we can. We don't have any questions as of now. We can take the
Okay.
next.
Wonderful. So this is the case of an 8-year-old girl who had cystic fibrosis, had multiple hospital admissions for pneumonias, and had been oxygen dependent at home for the past 1 year. So, and during that 1 year, she had increased frequency of admissions. And during the last admission, she was even unwilling to go to the hospital. She felt that something would happen. So the family made the decision not to bring her to the hospital again once we were able to discharge her. And she wanted to take a trip with the extended family, which she did, which fulfillment were planned with the unit. We had no idea when she would get sicker. She really wanted to visit the aquarium, and we had planned everything, how we could go with oxygen cylinders, and 2 or 3 team members were going to go with her. Unfortunately, we could not put this wish into make it a reality because she had a fresh episode of respiratory distress. So the parents panicked, rushed her to the emergency department, and she died on the way. But since then, the family has been, the bereavement support continued, and they keep on visiting the hospital. So 2 months, I write 2 months, but no, they came 2 months later, and now they come every year. So they came to return the oxygen concentrator. 6 months after she died, her elder sister and her mother came to distribute cake, coloring books to the children of the ward where she was admitted, pulmonology ward, and with the help of a counselor. And now every year, faithfully, they celebrate her birthday by going to that ward and distributing the same type of gifts for the children. So really the family felt that it was really therapeutic, and it was a family-led finding meaning, which we totally collaborated with them, got all the permissions for them to be able to return to the hospital where the child has been treated. It can be a very difficult, but at the same time, very healing step when once they feel that they are ready to come back to the hospital. And the final story is this 13-year-old girl who was tetraplegic following a fall from a swing that showed that she had actually a congenital C2C3 dislocation, and she had undergone neurosurgery and orthopedic surgery with multiple complications. We could not wean her from the ventilator. It took many months, but we could do that. And so her hospital stay was very prolonged. Up to she stayed for 18 months in the hospital. But we managed to wean off the ventilator with extensive chest physiotherapy and counseling, because there was more emotional dependence, psychological dependence, rather than physical dependence on the ventilator. She was tracheostomized, and it was finally closure of the tracheostomy. We planned to send her home when she had a sudden deterioration and died in the PICU. So it had taken us many months to help the parents to get ready for her to go back home, to take care of her at home. And then that sudden death was a very, very difficult, I don't know.
Yeah, I think it was a difficult experience, not just for the parents, but also every staff member who had worked with this girl. And so really the take-home messages from our session today is to understand and to acknowledge that children grieve as much as adults do. And typical grief is a normal reaction to loss. When you have a loss, there is bound to be grief, and grief is really an expression of how much you loved the person you've lost. And children may react to someone's death even if they don't fully understand it, like Dr. Vera was talking about the infants or the younger children, and they have different ways of expressing it, even though they may not understand the finality of death or the concept of death. Children need developmentally appropriate explanations about the death of their loved one, and we've been through that in our previous slides. Uh, Children may express their griefs through play and through their behavior or play, and bereavement support includes presence, listening, providing opportunities to share feelings, and ways for a child to remain connected to their loved one. These are some of the resources that we have. Some of these The last two resources are really how you can talk to children about death and how they can process their feelings. And we want to end our presentation today by a quote by Fred Rogers. It is from a movie. I think it is A Beautiful Day in the Neighborhood. And this quote really talks about death and the challenges in talking about death. And the quote is, death is something that many of us are uncomfortable speaking about. But to die is to be human, and anything human is mentionable, and anything mentionable is manageable. And therefore, it's really important for us as adults, as practitioners, to be able to talk about death, to be able to normalize it, and to deal with our own discomfort around it. Thank you for your attention.
Thank you, Dr. Veronique. Thank you, Ms. John. So, a great session about how grief is and what are the scenarios as well. Thanks for bringing it up. We have still time for taking a question or two. Any questions from our participants? I find them being very quiet. This is quite an intensive session. I agree. So we have a comment from Dr. Swati. Ma'am, is it helpful to the parents if Dr. talks about personal loss to express empathy?
So I think that's a very important question. So yes, talking about your loss to your patient or to someone is often helpful. However, it is how you talk about it. Now, you may if you have processed that loss and you're comfortable with it, and you're able to talk about it, then yes, it's helpful to learn it. But if it is still sort of really very raw, and talking about it might mean that it would require your patient to start reassuring you or consoling you, then perhaps that's not as helpful. It depends on how comfortable you are. And of course, to say that I've experienced loss as well, and I know how hard this is. It absolutely brings about empathy, but it's also in protecting yourself and talking about how much you feel comfortable, so that you don't lose your composure, and that your patient doesn't have to step in to the role of reassuring you. Is there anything?
Yeah. No, absolutely. Our own experience is can be helpful, but we should not need to be concerned with the parents themselves. And I think in our experience also, it is as pediatricians, we get attached to the children we look after. And the way we also express our own grief at the loss of the child, maybe the child dies in the hospital or at home. So it is good that the parents see that we care for the child. We also attach to the child, but with a self-restraint and measure.
There are some quite important comments, Dr. Ishaq, on. Shall we go through them one by one?
Sorry.
Yes. So one question here is from Dr. Navneet Kaur about telling mothers about loss of their newborn babies after birth. Should we tell mothers about death directly if they are not aware about a baby being sick? Many a times this is the scenario where the child is taken from the mother to a different center, to a tertiary care center. Could be preterm, could be term, sick term. So how would you approach?
Yeah, so within our hospital, we we have a lot of cases where women following, not just there are women who've had IVF, several failed IVF attempts, and then finally got pregnant with twins or with a baby, and often have ended up with preterm babies, and those children have gone on to die. And you can imagine with every sort of IVF attempt, the emotional and physical and psychological trauma that one has to endure. And then after all of that, if you lose your baby, sort of one gets an estimate of how painful it is. So to the question, should we tell the mother? I would say yes. It is on how we talk about it. Often it might be breaking news to the mother with people who are most supportive of the mother. So you might want to ask, when things are difficult, who is the most supportive of you? And so it's important to break news to them with those people being around. And it's on how you talk about, we have a protocol of breaking bad news. Within our hospital, we've actually started perinatal palliative care. So where we've known of children already having health complications, and we know that when the child is born, the child is going to pass away. We pay particular emphasis on preparing both parents and extended family, but also we carry out memory making in the form of, parents might want to hold their newborn baby, might want hand and foot prints of the baby. Or in some instances, we've had parents who've said, we'd like a picture with our baby, knowing well that the child has either passed away or going to pass away. And it's very painful work, but I would say.
Sorry, it's a
Yeah.
mistake.
So yeah, I would say it's important to be honest, but to do it in a protective manner where the mother is supported by a loved one.
What often happens is when the mother is admitted in another hospital and maybe she has had a cesarean section, she's not able to come to the hospital, then that news at times has to be given. Like we speak to the baby's father and other relatives, and we insist and we say, can the mother somehow come, or we want to make sure that the mother, if possible, can see the baby even after the baby has died, because it's one of the important aspects of the healing process. If I mean, it's not always possible, but we try to make it really, to ask the family. Sometimes the mother is at home in the post-natal period, and we try to insist on that to see whether we can assist in that way before the child dies.
There is one more question in the chat about one of the slides that were projected. What advice to give to mother to answer to the question, how many children do you have?
It's a very personal thing. I would actually always acknowledge that they were a parent of that child who passed away. But again, there is. So when you're asking what advice would you give, I don't think it is for us to advise really. Perhaps it is to prepare them that these questions will arise, and it's okay to say that I had 4 children, and depending on where they're at in their whole journey of loss, some parents find it very painful to tell their story again, so they just may not want to say they have 4 children. They just say they have 3 children who are alive. But there are other parents who say that I was a parent to 4 children, and one child has gone to heaven, or they will say that one child passed away. But there's no right and wrong about this. But I think for us, it's for us to acknowledge that these are difficult questions, and one ought to have sensitivity around the answers. But it really is all dependent on where the parent is at and how comfortable they are about narrating their loss all over again. So I think that it's probably there is no textbook answer to this. It's just preparing the parent that these may be awkward questions, and to start asking them, what would you like to tell people if they ask you this? Have you thought about what's comfortable for you, what feels comfortable, and not to sort of and uh, and for us not to judge whatever they say is. I would say my response to that.
Thank you, Ms. Sean. That's really helpful. Shall we take one more last question before we wrap it up? There was, sorry, I'm holding you up, but there is one question where they have told, trying to, sorry, I'm not able to see that.
There is a question about how to keep distant from the losses that we see every day. So,
Yeah, that's such a difficult question, but such a profound one. And it's one that I think as palliative care professionals, we experience day in and day out. To be honest, I always tell people that there's no way of doing this job without being connected. So if you are supporting families, you tend to feel connected to them, and when you feel connected, you are bound to feel the loss. So to the question, how do we keep distant? I think it's rather than saying we'd like to keep distant, um, perhaps we reframe that. How do we witness the losses that we are witnessing each day and not be affected by it? And within our hospital, we regularly have debriefing sessions for staff in the ICU. You all may have experienced there'll be a surge of death and kids dying one after the other when um, in a high pressure ICU setup, and we have debriefing sessions for professionals. So I think it's important as for and sort of sorry. Such a beautiful question that I think I should be more sort of in keeping with what you've asked me. I would say that it's hard to be distant, but it's possible to protect yourself. So to acknowledge that when some children pass away or when you experience loss, it's bound to make you feel sad. And if you've had losses in your life in the past, it might evoke memories of that loss, and that it's okay to experience that sadness. But also, I think when we do debriefing, we often think about, okay, what are the things that you appreciated about this child? What did you like about working with this family? What are the things that you did well? Or what are the things that you will remember this child or this parent or somebody who's passed away? What are the ways in which you will remember them? What are the things that you will cherish? So I think that a debriefing session really helps. Talking to somebody, talking to a colleague or reaching out to someone, because we all from time to time will get affected. And in all the years of doing this work, I'd be a liar if I say it's possible to just do this technically. No, you will get attached, and there will be times when that loss will feel like a loss that's personal, and that's okay. I think it is to sort of really think about what are the things that this family that you valued about this family or a child. What did you do well with regards to this family, and what will you remember in the future about this family? So I think that's helpful, and to really talk to peers or um, talk about your feelings, I think.
Thank you. That sums it up. How to take care of ourselves as well as how to not let it affect us. And regarding debrief also, where we do debrief with whole of the team, asking about how did a child's death has affected them, and the kind of relation they had with the family and all those aspects. Thank you, Dr. Veronique and Ms. Joan. Thanks a lot. We can take the discussion to our chat as well. Just in case if you have any queries, you can get in touch with our experts in WhatsApp. And thank you once again, everyone, for joining for the next session, which is on reflections from practice on pediatric palliative care. We have experts again, Dr. Veronique. We have Dr. Sabita, Dr. Smriti, and myself, Dr. Ishak. We all will be talking about our experiences and reflections from our practice. So thank you, everyone. Thanks for joining. I hope to see you again in a week's time. Till that, take care of yourself. Okay, then. Thank you.
thank you, Ishak.
Thank you.
Bye,
Thank you,
everyone.
Dr. Veronique.
Thank you,
Bye-bye.
Dr. Vivek.
Thank
Thank you,
you,
Dr.
Ms. John.
Ishak, and thank you, Ms. John. Thank you so much.
Thank you.